And the World Health Organization says there is a substantial increase in the weekly total of new Ebola cases in Guinea and Sierra Leone. In its latest update on the outbreak in West Africa, which has affected nearly 27,000 people with more than 11,000 deaths, the WHO reports that the week ending on May 17th saw the highest weekly total of confirmed cases of Ebola in over a month. There were 35 cases reported from Guinea and Sierra Leone. Guinea reported 27 cases, compared with 7 to the previous week. The WHO says the geographical area of transmission has also expanded compared with recent weeks. Because of the proximity to Guinea-Bissau of the recent cluster of cases in the Guinean prefecture of Bokeh, a response team from Guinea-Bissau has been deployed to the border to assess points of entry. Joining us now live via Skype from Paris, France, for the latest is Carissa Guild, a registered nurse and medical team leader with Medecins Sans Frontieres, MSF. Ms. Guild, welcome to Africa 54.
Thank you for having me.
So there are new cases emerging in Guinea and Sierra Leone. What is your analysis of the situation presently?
I mean, last week or 2 weeks ago, they reported 9 cases in the 2 countries, 7 being in Guinea. When you looked at the details of those 7 cases, 4 of the cases were community deaths. So 4 people had died before we realized that there were cases of Ebola, which just shows that right now there's transmission happening in those 2 countries that we're not aware of. And this means that the outbreak is still ongoing as it has been.
So it's still ongoing. We've seen a case in Liberia where the country was at some point the highest infected in terms of number of people. Now it has been declared Ebola-free. What has worked with Liberia that is a lesson learned, really, that could be duplicated or is being duplicated in the other 2 countries?
I don't know if there's a lesson learned between Liberia and the other 2 countries. I think the same strategy has been put in place for all 3 countries, more or less. It's the same actors, and the governments are different, and the people working are different, but the response to Ebola is the same. Perhaps in Liberia, it was most of the transmission happened in Monrovia, which was a very tightly populated group of people. And once they realized that the communities had the power to stop transmission and to stop Ebola, the communities really stepped in and did a lot of work. I think the same thing is probably happening in Guinea and Sierra Leone, but maybe not as effectively right now. And there has been a lot more resistance in Guinea since the very beginning of the outbreak by the population.
So what is your perspective in terms of where the priority should be now?
I think that there's 2 priorities. I think that there is definitely a need to stop this outbreak, which means 0 cases. We saw that this whole thing began with 1 case. Now we had 7 cases last week in Guinea, which has rose. These 7 cases have brought forth 25 new cases, so it can grow rather rapidly. So I think, yes, having heightened vigilance, trying to discover all of these transmission chains is very important. I also think we need to look at a little bit post-Ebola. Right now, the 3 countries haven't had very well working health systems for over a year. It's very easy to see in Liberia right now. They just had their first mass measles campaign. There were lots of measles cases in the city, so there's a lot of other things in rebuilding health structures, which is also going to have to be a priority.
Okay, Ms. Gill, thank you so much for joining us today.
Thanks a lot.
And that was Carissa Guild. She's a nurse and team leader with MSF. That's our Africa Health Report for today. Vincent?
Well, Linord, thanks. Now be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on Africa 54.